We're back. This is Dan Limmer from Limmer Creative, and I have the good fortune again to be sitting with Bill Brown, the former director of the National Registry of Emergency Medical Technicians. He spent 28 years there and has created a product for us called NREMT-prep PASS. While I could be accused of being mildly prejudiced, it's an amazing app which not only does amazing learning, it does spectacular test preparation, has almost 500 audio rationales that really give students amazing insight into everything from pathophysiology to assessment and care and certainly into taking the exam. So I think that's a great segue into talking with Bill Brown about how students, well, screw up. What mistakes do they make in regards to the certification exam? And I had the chance to sit down with Bill, and we made a list of things that we thought were important. And I think you might even be surprised by what some of these are. So when you ask the exam guy what they are, I was a little surprised myself. So, Bill, welcome.
Hey, I'm glad to be here, Dan.
All right.
Ready to go.
All right. Number one, I'm just going to go through them, and then you're going to be driving the bus and saying what they are. One of the things that you said to me, which I wrote down first, is that students studying in the parking lot, are they studying at the right time and the right amount?
No. You want to go in there with a clear head, not what we call a brain dump. You know, they give you this whiteboard and you're going to write down tons of things. No. It's not a memorization. That test, or any good certification test, is going to make you apply your knowledge. And that has to be obtained before
the parking lot.
An hour before the test or a half hour before the test. You know, memorizing pediatric this or whatever, the points of the Glasgow Coma scale, you got to do that before that. I actually see nothing wrong with taking a couple days off and studying from sun up till sundown and having flashcards and key points, but studying the parking lot, that's a waste. I mean, if you don't know it before you get to the parking lot, you're in trouble. You're in real trouble. So I think the best thing to do is get a good old night's sleep and get in there in the morning when your brain is fresh and do the best you can.
Have a clear head going in.
Oh, absolutely. I don't go out the night before and get toasted.
We'll stay in the test center part of the exam. The next one that we came up with is anxiety on whether they will finish on time.
I don't know whether people have talked about it, but the National Registry has stated many times publicly that the average person finishes each question in 34 seconds, and they're allowed 1 minute per question. And that failures don't fail because they ran out of time. So I think the best thing to do is some of the questions you'll get in 10, 20 seconds, and some may take a minute and a half. Well, if you're over that minute marker, don't just guess right then, oh my God. And don't be looking at your watch or anything else. Just, come on, just go through it. Time is not the enemy. That's been stated many, many times. So I think that I got to finish this is a big, big mistake. You should be analyzing and reading each question carefully in its lettered answers. That's what it says in the instructions. And don't make time the enemy, and don't get anxious about it. You're going to have plenty of time.
In the test center, and talking about anxiety, a lot of people become anxious or frustrated when they don't know an answer. And there are going to be some that they're just not going to get.
Oh, yeah, that's right. Yeah, that happens
to
me, Dan. I take the test myself and for recertification, and there's 3,000 paramedic items in the bank, and there's no way I know. You got to be kidding me. So I'll get to a question. I'll be like, oh, God, what the heck is the answer to this? So I'll spend my 30 seconds or so trying to look from a pathophysiological approach about what are the obviously wrong distractors. And it's a tough question, or I wouldn't be seeing it. So it's really high up there on the Logit scale. And then I'll just go, well, I think it's this, and I move on to the next one. And I don't let one incident affect the next one. Just like you can't let one call that you didn't do everything right affect your next call. We're not going to get everything exactly perfect. Then our patients don't act the same. Things don't happen the same. That's one of the beauties of EMS. It's not boring at all. Everything's different and crazy. Don't get flustered about what you don't know. I mean, forget it. Just let it go. Let it go. And there's pilot items on there, and they may be a lot harder or a lot easier than how you're doing. And you don't know when you're going to be faced with a pilot item. They come up irregularly just throughout the test. So forget it. You got a question. You did the best you could on it. Get on to the next one. And don't rush through it, but get on to the next one, and don't let it emotionally affect you. We have to be pretty thick-skinned in EMS, and we have to be resilient. And if you're not resilient in test taking, maybe this isn't the occupation for you.
Well, most people do consider the exam character building, if nothing else.
Yeah, there you go.
When they leave. When you study for the exam, going back to study, we'll leave the exam room, we'll talk about preparation for this. A lot of people study facts and figures and respiratory rates and lots of other things. And while it's important information, one of the points you brought up is that recall is not what it's all about.
No. This is a licensure exam. It's an occupational exam. The American Psychological Association, which is sort of the Bible on how to develop a test, says in an occupation exam you should test the most important functions of the job. That test goes after, and any certification exam should go after the most important functions. Memorization of trivia and simple recall. You got to apply your knowledge. I appreciate you got to have it to apply it. If you don't have it, you can't apply it. But that test is going to try to drive you to the application of it. When you're given this license, there's an assumption that you know how to apply your knowledge. So why wouldn't the test be about that? And it is. Recall questions. Oh, geez. And I'm telling you, Dan, I'm not the reviewer for various textbooks that are out there that are called prep books or whatever. But I've seen a hell of a lot of recall questions and a lot of poorly constructed items. And I'm talking about poorly constructed because of the failure to use the best techniques in item writing. Because they're unknown to many, many people. That wasn't their area of study. They might have been studied to be a paramedic, but not a test item writer. They have recall questions. They're easy. Everybody feels good. They walk out, I got 92% of them right. So what you have then is a false set of confidence. But where's the competence? See, this app I think that we worked on and that I put together gets you confident and competent. And those two together are going to be what you want to be when you get on the ambulance. Because it's scary, your first couple bad calls. Oh my gosh. But if you're made it through this and you are confident and at least entry-level competent, if you can maintain that confidence, your competency through experience will go up. So we want to get you both, not just falsely confident. Because today, many people are cocky and they think they're the best and they're confident, but where's their competence? That's what I want to know about.
Well, it certainly is a thorough product and gives people the tools that they need to do that. Now, talking about the exam, you have to know how to apply that knowledge. It really goes with not studying recall. We want people to make decisions, to be able to evaluate and do higher level cognitive things on the exam. So you have to know how to apply your knowledge. And students don't do that a lot of the time. They're still looking for those easy answers.
Correct. Scenario writing is an art. And reading the book about the don't do this when you write an item, don't do this, don't do that, gives you the science. Just like red, yellow, blue, green, indigo, and violet are the colors. And if you start mixing them together, you can get all different other kinds of colors. Oh, white and black are also in there. No matter what, that doesn't mean you can paint. It doesn't mean you're an artist. Well, that requires art. And if you don't practice art, you're not going to be good at art. And so you got to practice that. And that's pretty tough to do. And the art is to find out if the person can apply their knowledge. That's the question. Can they apply it or can they not? People will write 10 line scenarios and say, I have scenario-based questions. And 8 of the lines are bullshit. Get to the point, but have enough information that you challenge them. That's really an art.
Students don't see a lot of those good questions in class. That's probably one of the issues.
Oh, I think so.
Yeah.
I think so too. And I've encouraged educators many times to write tougher questions that challenge the student. If you give your first test in class and everybody gets a 90 on that test and they studied, let's say, 3 hours for it, the next time they're only going to study 1. What you do is say, oh, they got too high a score. So you write a really tough test, the second one. They only studied 1 hour, and then they all flunk, and you think you don't know how to write a test question, or something's wrong with the way you taught. So what you're doing is you're trying to get your test. You get so many people to get A's, so many B's, and so many C's, and so many D's. That's crazy. The better thing is to give them a rigorous examination and then curve it. So the sharper students get A's if you're inclined to do that. But community colleges with 90 to 100 is an A. Well, if I had to create an exam that 90 to 100 was an A and I felt like my best students should be A students, then I have to make 80 of the questions out of 100 easy. That doesn't cause them to learn and study. Tests are about affect. And the people that don't want to put the effort in shouldn't do well. If you have easy tests, they're going to do well.
Well, I'm looking forward to doing the podcast that we have coming up on tough questions. I think that will show the character of some of these. So for the instructors that are listening, it sounds like the message is to make your test tougher. People will have to rise to the level of those exams.
I've been preaching that for 28 years. I'm not sure how it worked.
Well, we'll try it. And for students, you'll know that this tough love of giving tougher exams will certainly do you well when it comes to taking your national certification exam, because you'll have more experience in this one applying your knowledge.
If you're not a good test writer, tell your students to buy the app.
Buy the app.
That's it.
All right, we'll do that.
But I'm not trying to push it. I'm just trying to tell you that y'all got to get some tough questions then, even if you didn't create them yourself.
There are some great questions in there. I really enjoyed going through each and every one myself. So we'll go to the last one. Now, test question practice is vitally important, and I will say that your product not only gives test questions, but it gives audio rationales, mini lectures that you can listen to. That's great. But the book is important too. So the last topic we have that mistake students make is they don't read the book through the class, or even when they study sometimes. They don't go back to the book.
Yeah, I think that's true, and it's because we'll use that ruler effect. If the 6-inch is the pass, all of those questions are from the book. Not one book, but they're in the EMS literature. And if the result is Swiss cheese in the student's mind, why are those gaps present? Well, I don't know. I don't follow them. Neither does any teacher look over their shoulders 16 hours a day, assuming they sleep 8. They don't look over their shoulders, but I have a theory that a lot of times they don't read the book. And that's too bad. And maybe one of the first classes ought to be how to read the book and how to highlight it and all those kinds of things, and how to get back to certain key points that are in the book. That's very confusing, though, for a beginning student who they don't know what's important and what is not. But it is still essential to read the book. Read these EMT textbooks. Boy, there's a lot of real great nuggets in these books. And if they're not reading them, they're just listening to the instructor and maybe taking notes. That's another whole skill that I think students have lost. Or watching the PowerPoints, and I just think they're going to end up with Swiss cheese knowledge, and that's not good. There's some real nuggets in there.
All right.
So I'd read the books.
6 mistakes students make in regards to certification examinations. I'm just going to read through them one more time here, so we close with those. Studying in the parking lot, that is not efficient. It kind of clogs your head. You should be studying beforehand. Anxiety on whether students will finish on time. Don't have it. You have plenty of time to take the exam. Becoming frustrated and having an emotional reaction when you don't know an answer. It's going to happen. You have to roll with that and move on and make good choices there forward. Don't get hung up on it. If you study material that has depth and not just recall material. not knowing how to apply the knowledge really goes with the previous point that the examination is about application of knowledge, not about recalling knowledge. And then finally, as Bill said, the book has a lot of valuable material. A lot of times there are conflicts between what the instructor says and the book says and another source says. Multiple sources are your friends, especially for decision making. You really should be reading the book, getting those nuggets of information. As a book guy, I kind of like that, so I was glad that there's value in that. So my name is Dan Limmer, the founder of Limmer Creative, limmercreative.com. Here again with Bill Brown, and thank you.